We often have a lot of questions from our patients because they read on the internet and they say, do sugar actually feed cancer? So we thought it would be great to have our keynote lecture to address this particular question. Calorie restriction might actually help in terms of treatment of cancer with chemotherapy, radiotherapy, and also help to restore some of the immune system surveillance of the cancer. So there are now some pharmacological but non-toxic molecules that actually can mimic the calorie restriction but without causing weight loss. Our patients, especially in patients with so-called upper GI cancer, often will present with malnutrition. If you try to restrict the calories, that might be even worse. So I think this keynote address would be of great value to our group of patients, but also to cancers on a whole. See you in Barcelona.